quinine and malaria.
So what is quinine? So quinine is a chemical compound used to treat malaria caused by Plasmodium falciparum, which is transmitted through the bite of female mosquito. There are two natural sources to get quinine, cinchona and limia. Especially limia is used for making tonic water because it is inexpensive than quinine obtained from cinchona. Quinine structure. Quinine consists of aromatic and amine components. It has 4 stereocenters. This 3-part synthesis shows a total quinine synthesis completed by Woodward Doring in 1994. Quinine chemical formula is C20H24N2O2. It has a clear color and bitter taste. We can get this from the bark of a cinchona tree. We can use this for treat malaria and leg clamps off the label.
Discovery of quinine. Quinine was first derived from the dried and powdered bark of the cinchona tree found in South America. The Quechua of the Andean highlands used the bark in an herbal tea to relax muscles from high-altitude sickness. The Jesuit priests were the first to use the ground bark of the cinchona tree to treat malaria victims in 1632. It's said that Ana de Osorio, who was wife of the Count of Chinchon, who was viceroy of Peru, contracted malaria. She was cured after bathing in a small pond underneath a quinine tree. Linnaeus later named the tree in her honor. Cinchona powder, more valuable than gold or silver. The Spanish controlled the source of the Jesuits' bark, or cinchona, for over 300 years. It was used as a life-saving malarial treatment, especially in Rome, Italy, and France during those years. By 1826, 3,500 kilograms of quinine sulfate was being produced in France, which required 150,000 kilograms of bark, all exported from Colombia and Ecuador and Peru. Seeds of the various cinchona trees were smuggled out, but were in low quinine-yielding varieties. It was not until 1865 that Charles Ledger of England was first to initiate quinine production in the Far East from high-yielding trees from Bolivia. Dutch monopoly of quinine. Tonic water. Cinchona legionaria, smuggled out of Bolivia by Charles Ledger, produces an amazing 13% quinine from the bark of the tree. Because of the bark, anti-malaria treatments were available to Europeans. It is credited for the colonization of Africa and the West and the Near East and Far Eastern empires of England. The gin and tonic drink of the empire is in fact gin with quinine, a treatment for malaria. Java, a Dutch colony, became the largest producer of quinine and held that monopoly until 1942. When the Japanese invaded the Indonesian islands, the monopoly was broken, depriving Europe and Western nations of its supply of quinine. Synthesis of quinine was investigated, but it was plantation sites in Central America that finally produced quinine for the United States and European troops for malaria treatments. It's estimated that thousands of soldiers died in World War II to malaria because quinine was not available.
Before visiting regions where malaria is present, there are more treatments for malaria such as chloroquine, mefloquine, doxycycline, and malarone. But first, what exactly is malaria? Malaria is a potential life-threatening disease transmitted through the bite of an infected mosquito carrying the Plasmodium parasite. Interestingly, female mosquitoes of the genus Anopheles are the main culprit of malaria transmission in humans. Females are the only ones that take blood meals so that they can utilize the protein and iron found to carry out egg production. International travelers and immigrants who come from and visit tropical and subtropical areas are most likely to get malaria. The areas highlighted in red are the regions where malaria transmission is most likely to occur, with the highest malaria transmission being found in Africa, south of the Sahara. This is due to the warm climate and location being close to the equator.
So let's go over a list of why malaria is potentially life-threatening. First, when a human is infected with malaria, it begins by infecting your liver, and then it'll grow and then multiply and then start infecting your red blood cells. Your red blood cells will essentially burst, and daughter parasites are released, which thus invade the other red blood cells and thus begins a vicious cycle. And after that, the parasites can adhere to the blood vessel walls and inhibit the body's ability to circulate the infected cells efficiently. Malaria causes 1 to 2 million deaths per year across the world, but it is manageable with the proper treatment. After being infected by the Plasmodium mosquito, of which there are 5 distinct species, symptoms can appear as fatigue, headaches, muscle aches, nausea, and high fever. With the right treatment, a cure for the disease will come along in weeks. Proper treatment depends on these characteristics of the patient: severity of symptoms, whether pregnant, and the age of the patient. Treatment for malaria is preventative based, and it is taken through a prescription tablet before you go into that area with potential infection. And some of the warnings associated with the drugs used for malaria include the following: leg cramps, unusual bleeding or bruising, severely low blood sugar, etc. And some of the side effects from the drugs include diarrhea, chest pain, dark urine, etc. And some patients choose not to take a specific drugs just because the side effects are too severe. So one of the treatment options for malaria is through the travel clinic at the University of Utah. And the clinic itself specializes in all sorts of infectious diseases. And it offers pre-travel and post-travel consultation. And it is imperative that travelers receive the feedback they need before departure as well as upon coming home. And infectious disease specialists will evaluate the patient for any sorts of travel-related diseases.